Okay. Okay. This is all going to be very formal. I hate writing down questions and then looking down at them, and then it's always the worst.
You can rapid fire. I'm ready.
Okay. How much county money is being spent directly on addressing the fentanyl crisis?
I think it's a good question, and it really, we need to define what county means. And so when you say county revenue, funds that are coming directly from county taxpayer dollars is nominal. In fact, most of the money, if not all of the money that is spent on this and other issues are actually coming from the state and the federal government through various grants. And what we do as commissioners is we will apply to receive a grant from the state, for example, and we will say, who in the community can provide a service that would be eligible, and then we will make them a sub-grantee. We also, though, have the added funding source now from an opioid settlement that was a result of a lawsuit that was filed by the state of Washington against the pharmaceutical companies. And so between the grants and the settlement dollars, those are the funds that are being spent. Right now, the cumulative amount is about $3.5 million annually or more, based off those grants and some of our opioid settlement dollars, and those are across varying levels of prevention and treatment and criminal justice aspects.
And has that number gone up or down over the last few years?
It's increased significantly,
okay.
Really because of the focus from the state legislature and with our criminal justice system having a change in how we approach people who are convicted of crimes while they're under the influence. There's a lot more diversion courts. We have a drug court, we have DUI court, we have a behavioral health court. So we're seeing an increase in funding from that perspective. And then, of course, we do have those additive opioid settlement dollars that certainly didn't exist previously, and those have just come in the last couple of years.
Yeah, because I noticed when you sent the email, all the kind of money is divided under certain things.
Yeah.
Like you said, those like subdivisions.
Yes, we're very focused on trying to hit the various points. Certainly folks who are already addicted, folks who are involved in the criminal justice system, folks who are looking for help for youth. We're trying to really put an emphasis on prevention. And for my part, as a mother to young children and the youth being our future, I feel that is the best place to put dollar for dollar to try to prevent this epidemic from expanding even further than it already is.
And would you say, I know you were saying, okay, it goes into recovery, it goes into prevention, it goes into law enforcement. Would you say that 3.5 is evenly distributed? Is there an area where there is more money towards one of those three?
It isn't. I would say that we don't have as much funding for prevention, and that isn't because we don't want it. It's because the prevention has not actually been a focus for providers nor the legislature, and that is something that Yakima County and myself in particular, as well as with Safe Yakima Valley in partnership with them, really wanting to focus on. And the Board of Commissioners has really put a priority on that. There just hasn't been as much opportunities, but I would say dollar for dollar, the best money that we have spent is through Safe Yakima Valley on youth prevention. Absolutely. One of our larger programs is the medically assisted treatment program that is through our Yakima County Jail, and that is about $750,000 annually, and that provides a service to people who are addicted while they come into our criminal justice system, and if they are incarcerated, we will provide that treatment to them to try to help them come off that substance abuse while they're in our care.
And I know you mentioned prevention is kind of on the lower end when it comes to legislator. Why is prevention so important in your opinion? It's logical. The best way that we're going to attack something that afflicts people who it is so addictive
There are plenty of studies that demonstrate that once someone is addicted to opioids, that it takes several attempts at treatment, if done so voluntarily. And so it's incredibly costly as well. And I think that we can all look around and see that our communities are suffering under the financial burden of the costs of this issue, not only in the medical sense, but in the human expense, in the expense of our criminal justice system, law enforcement. It is something that the cost is so enormous, it's really hard to articulate how far out it goes. But I think that from a prevention standpoint, if we can reach people, especially our youth, and say that this is something that is going to end up costing you everything, including your life. This is not the smoking marijuana of the 60s. This is not having an occasional beer if you're underage. This will kill you the first time you do it. And it is something that likely will cause you death, even if you think you're taking something that might be, quote, safe or represented to be safe to you. There is nothing that is safe if it isn't coming from your doctor. And even then, we need to make sure that our prevention includes clear communication about how to recognize even not taking too much of a prescribed medicine. And I think that gratefully we've seen from the medical community a self-reflection that their ways of prescribing opioids definitely, caused a lot of this harm, and that is why we do have some of these opioid settlement dollars that came from the pharmaceutical companies who were working with the medical community to prescribe them in such a manner that unfortunately really caused a lot of folks to become addicted.
It's a slippery slope because a lot of people will either go the route of, okay, I have this medication, my doctor or the hospital told me to take this for 4 days and then I'm good, I'm done. But they gave me 7 pills. So after 4 days, I just want to continue to do the pills. Most people, they just either throw the pills out or they just don't use them after they're feeling better. But then it's like the slippery slope because you can either continue to take the pills or you might even try to sell it to someone else. Even though that's not the case half the time, most people just do it until they're feeling better or they might not even take it at all.
I think that that's a really good example of how awareness in our culture has changed and shifted. It's a fine example. Maybe 10 years ago, you would have followed the directions from your doctor and the pharmacy to a T. I'm supposed to take this for this long, and now even the communication from the pharmacies and the communication from the medical professionals are, we're prescribing these. I know that they are offering options. They actually will let people know that we could give you this, but there are alternatives. Would you like to consider those? And then if someone does choose to have the opioid, for example, they will say, you do not have to continue taking this. If you are starting to feel better and feel that you no longer need it for pain, then please dispose of it properly. And of course, that's why we have drug take-back programs that have expanded now, because I think the message is getting across to people that just because it was prescribed to you does not mean you need to take it if you don't feel the need. I know that my own father recently had hip surgery, and his doctor at the VA was very expressly cautionary and let him know that you don't necessarily need to have this, and we want you to make sure that you keep an eye out for these types of symptoms that might be a precursor, an indication that you are becoming addicted. And so they're very good about being upfront about that. And I think that is something that we can all lay claim to as an accolade as a culture, to understanding, that these things can be dangerous when not used correctly.
Especially, what about the elderly? You're in the nursing home. They're the ones giving you your pills every day. There's
a lot of trust there, and it's another good example. In that case, they are certainly subjects, if you will, to the medical staff who are putting a pill in front of them and saying you have to take this along with your other daily vitamins. And so educating even those caretakers about ascertaining whether or not someone really does need that advanced level of pain medication, or have they moved on past that point where there's something else that they can have. And I think that those are conversations that weren't happening 10 years ago, and they're happening now.
And then there's the education even in the home. You say you had surgery or your husband had surgery and you have pills lying around. Kids are going to be curious. They're going to see it there, they're going to think it's candy, and then we have another news story, we have something in law enforcement that law enforcement's responding, someone OD'd, 15 years old, 16 years old, even maybe a baby, because it's just out in there.
I would like to think, and I do believe, that there are less of those occurrences happening because, again, of the great cultural shift and knowing that if you have something left over, we do need to dispose of it correctly. I would actually say our drug take-back programs are a form of prevention in that sense.
And speaking of programs, because you mentioned the one in the jails, what are some programs that the money goes to that you believe are working?
The youth prevention is something that I think is incredibly important, and what's important and different what Safe Yakima Valley is doing is actually data driven to prove over a course of decades of studying of what methods and what communication is being presented. It's actually more of a behavioral system of teaching young adults ways to set boundaries and to say no, especially to people that are trusted. For the reasons we just discussed, sometimes you might have someone who is a trusted adult who says, oh, you can take this. And so traditionally, a youth would say, well, this is a person who is a trusted adult, I'm supposed to do what they say, and maybe just take that. And now the communication is, how do you say no to even people who are trusted? Or how do you say no to your friends? Rather than, at that point, we're giving them the tools that they need to be able to set boundaries for themselves without the expense of losing friendships, and being able to do that. And it really is arming them with that emotional maturity to make those big, bold decisions as a young adult, where previously the types of communications for prevention were, this is your brain and this is your brain on drugs kind of a thing. And there are many different studies that show what are the right ways to have a lasting impact on communication to youth. But really, it is about empowering them to make decisions for themselves that they know and feel confident are going to be lasting and healthy and give them longevity in life, versus just looking at compartmentally about not choosing to use a single substance.
And to add to that, is that also helping with even something they've experienced in their personal life? Whether it's like their parents' divorce, that abuse, like that numbing feeling, they went through something that they need that numbing feeling. Does it also kind of touch on that as well?
I think the training, it is safe to say that the training actually allows them, again, because it's more about a behavior and learning and understanding how to set boundaries, hard stop, that will help them and transfers over into other aspects. So if they are perhaps in an unhealthy relationship somehow, that's the type of training that is going to allow them to perceive that they are in an unhealthy situation, and how are they going to set an exit plan for themselves to get out of that unhealthy situation. So I think the benefit there is not only is it youth prevention of drug use, it's also helping them have the tools and skill sets that they're going to need to navigate difficult decisions and relationships going forward in their life, not just about consuming narcotics. It's about how to make healthy choices for yourself, period.
And I deviated a lot, I apologize.
That's okay.
Are there any services being cut to make room for, I keep saying crisis, I don't want to say crisis anymore, for fentanyl in Yakima County?
We have not closed down or transferred funds from any other program. So no, there's not been a loss of programming for any other objectives. It's only been an expansion of programs.
Okay. And we already talked about the prioritizing. Are you seeing, well, no, I'm not going to ask that either, because how do you measure success in this crisis? Fewer overdoses, fewer arrests, more treatment. How would you measure that?
I will say that I don't know that the community as a whole quite knows yet how to measure success, other than to say that we're not there yet. This is something that I have grappled with personally, especially when it comes to how to allocate funds towards programs, because if you're going to fund a program, you expect a certain outcome, and reaching that outcome means success. This is in its infancy. There is no data yet that will support a conclusion that we have achieved success or not. Personally, I would say there's small successes in some that we've already described, that I think awareness in the community and especially in our youth as a whole has increased, but we still need to do more. I would say there have been huge successes with the federal government being able to close our porous border and focus our law enforcement efforts on trying to stop the illegal stream of drugs coming in. The focus had been so much on the humanity that was coming across the border that it most certainly allowed for the physical aspects of the drug trade to continue in areas previously unknown, and we've already seen success there. I think that we also can support federal endeavors to understand the connection between China and Mexico and the drug trade. So I think that there are successes that we've seen at the border with federal policies with our international partners or adversaries. I think locally we can say that prevention is a priority, at least for the Board of Commissioners, and I think that that will prove out to be successful. But I think right now, it is difficult to say if we have fewer overdoses, because overdoses can be reversed by Narcan. So if you were to say we dropped our overdose deaths, but we, at tenfold increased Narcan use, is that necessarily success? So I think it's really important for us to be cautious and really contemplate what success looks like. My preference would be prevention. Again, how do we prevent as many people as possible from entering into this cycle? Because funding is not the problem. We can continue to spend money on this, and there is a will to do so. For me, I guess, just off the cuff, I would say success would be we have fewer arrests, fewer Narcan, fewer overdoses, fewer people using drugs, self-attesting to it, and we are spending less money on the problem. If we can spend less money on the problem and have less evidence of it, I would call that success, but I haven't come up with a way to measure that yet.
I'm glad you mentioned that, because even when speaking with Alicia, they're documenting overdose deaths, but they're not documenting how many people did not die. How many people got that Narcan? How many lives were saved? And it's kind of hard to even measure success, like you said, because it's something so small. It's not like the heart of the issue. And I don't know if there is ever going to be a way to measure success unless all the drugs on the planet just disappear. But we live in a world where that's probably never going to happen.
Well, for an example, I would say, if we got our drug overdose deaths to 0, but we were administering 300,000 cans of Narcan a day in our county, or a year, excuse me, is that success?
Right.
Right. So there's no way. I don't feel that there's just one measurement. I think that there's going to have to be a holistic approach. But yes, I would say that the less money, if we see a decline in funding because there is no need that meets the funding, then that is definitely going to be something to show that we have achieved some form of success.
What would you say to, here's a stat she gave me the other day and I wanted your opinion on it. What would you say, what was the stat? Yakima County is the number, you know what, actually I wrote it down.
Sure.
I wrote it down.
We're usually number one in a lot of things related to this.
Yakima County is number one in overdoses per 100,000 in the entire state.
Yep.
And I don't know, the number kind of shocked me, and being number one kind of shocked me because, don't get me wrong, Yakima County is huge, but across the state. Mm-hmm. That's what didn't sit right with me. I'm like, are you sure? She's like, yes. So what are your thoughts on that? Because I know I'm sitting here like, how? When?
Well, I think it's important to note there are a lot of things that go into that. Measurement, who's measuring, right. Who's not, are they accurate? One thing I will say is that we've worked very hard to make sure that we're accurate in our measurement. So I will say we're number one. I have confidence in that data, but I don't have confidence in the data that's being supplied from other counties. I would also say that we have put a high focus on mapping our Narcan use so that we can be accurate. Again, I do not have that confidence for other counties. We are tip of the spear on that. So I would say that while we're number one, and that's disheartening, I would say at least we have been honest enough and transparent enough to pursue truth, and knowing truth is the best way to find a solution, because you can't solve a problem if you don't know what it is.
Right. And what programs or services do you, well, we kind of touched on this, are being kind of underfunded? I know that number 3.5, it's going across the board, but prevention's kind of on the end of it. It's getting there, and the efforts are there, and the efforts are great, but it's on the end of it. It's on the butt of the issue.
There is an opportunity to increase prevention, and I'll provide an example. So there are funding from the state directly to our school districts that they provide what they proclaim to be prevention. I don't agree with that. I absolutely agree with the stance from Safe Yakima Valley, which is that prevention does not mean having someone who's a mental health counselor with specialties in addiction treatment sitting in a room waiting for someone to knock on their door and say, "I'd like to talk with you." Prevention is actually a program. And it has to be delivered in a curriculum that is data-driven and tested, and it has to be in a certain time frame, and it has to be specific to the age groups so that it's age appropriate, and it is ongoing. And I think that what we're seeing is that the state legislature is funding through the school districts at great cost to have full-time counselors on staff in mass and calling it prevention. And I simply disagree, and I think that there are other ways that we can expand true prevention curriculum into our schools. And I will say it's been very disheartening to see that Yakima County, the Board of Commissioners, has been the only one to provide funding to Safe Yakima Valley, whereas the school districts and our state superintendent of schools has gone with a much more expensive approach that is not proven to be successful for prevention. So I would like to see the state take on a committed effort to incorporate actual curriculum like Safe Yakima Valley uses as a part of our school curriculum. And this has been something that I've requested and proposed. It's certainly something that other commissioners and other people experienced like Ms. Strami-Tobin have proposed. It is something that they have thus far resisted, and I think that's a frustration that I share as a taxpayer, is that there is a cheaper alternative that is actually proven to have a high success rate, and the state is determined to simply hire more people. And I'm certainly not saying anything against having counselors, but if you're going to represent it as being a way to truly prevent narcotics use and opioid abuse of our youth in middle school and high school, dollar for dollar, it is not going to ever come close to the results from a curriculum that's proven like Safe Yakima Valley uses.
It's like beating around a bush.
Let's put it this way, we wanted as commissioners to give Safe Yakima Valley as much as they could possibly spend. $40,000 in a year. And what do you think the cost is of one mental health counselor in a middle school is?
Probably more than that.
So my point is made, and again, there are certain reasons why you want to have those counselors, but again, if you're representing them to be a part of truly youth prevention, that isn't it.
Yeah, because those counselors, they are very generalized in what they're talking to students about.
A counseling relationship is that it's therapeutic, but again, prevention is a curriculum that teaches you behavioral skills over the course of a condensed time, and it is truly a curriculum, and it is evidence-based. And simply having someone there to talk to when you have a problem, that there's no comparison.
And to even add on to that, like the prevention and having counselors over the curriculum, sometimes, because this is all about prevention. If they're not getting it at home, it'd be nice if there was a curriculum at school. And it would be nice if they both got it at home, even if it was in small doses up until they go to college and be at school.
There is no reason why the state of Washington cannot adopt a proven youth prevention curriculum into the existing health programs and health curriculum that various students receive. We have sex ed. We have all sorts of curriculum that is made mandatory by the state, and I am a huge supporter of parents' rights, which means that just like any other curriculum, there will be the opportunity for parents to, voluntarily opt out. But it certainly should be something that the school superintendent for the state, OSPI should be all over this. And you have to ask yourself why. And again, I think my personal perception is that is a bargaining tool to be able to add more staffing to schools rather than actually seek to solve the problem.
Yeah, because I even when I was a kid, it wasn't an exact curriculum, but we did have someone who came in once a month. We took the whole class on it. So it is kind of odd to just, instead of making it a curriculum, just add more staffing, add more counselors, add that support. And even then, it's not like they can force you to go to the counselor unless you're having some
Well, I find it to be intriguing that the state decided that they were so concerned about students' health during COVID that they didn't want them to come to school, and yet the #1 threat to them is drug overdose. And we still, after these many years of being back after COVID, they have not seen fit to create at least a curriculum for prevention. So if you care so much about students' health that you didn't want them to come to school for 2 years, but now you do want to completely ignore the fact that there's an opioid crisis going on, it makes me really question the logic of the state leadership when it comes to our schools.
I almost want to ask the superintendent now.
You should.
An interesting point you made. So what kind of funding does Yakima County need from the state or federal government as of now? We've already talked funding. We already talked a little bit on the stats, trends, numbers. What kind of funding is needed, if any?
Yeah, my response is we don't need more funding. We need changes in law. A lot of the reasons why we are where we are because of poor laws and a lack of the ability to enforce. And what we've seen is that is when we started to go and move away from consequence for actions as a state, we see people committing more crime. When you do not have consequences, it is no different than having a child in your home. If you touch a hot stove after someone has told you that don't touch that, it's hot, and you learned that lesson as a child, oh, it is hot. I did burn my hand. But right now we're telling people don't touch the stove, and then we're giving them an oven mitt and telling them go ahead, actually, it's just fine. And eventually that oven mitt, though, is going to burn and fall off, and then you are going to really hurt yourself. I think that the state legislature needs to take very concerted effort to once and for all take care of our Involuntary Treatment Act, so it's the ITA. It is really, again, illogical to me that the state gives so much deference to known drug addicts where they are allowed to have infants, toddlers in their home when they are known to be addicted to drugs, and yet we've rolled back parents' rights for people who are law-abiding citizens who simply want to have a say in what kind of medical advice is being given to them while their child is at school. So we don't have the same rules. We're bending over backwards for people who have known problems with drug addiction, and for law-abiding citizens, we treat them more harshly and we judge them to not be able to provide sound advice to their children. So I think what we need to see is if someone has been brought back from death by the administration of Narcan, that it is safe to say that it is not an infringement on their civil rights to know that they literally died, and the best case is to involuntarily put them into an ambulance, take them to a hospital for stabilization, and then immediately transfer them to treatment. That makes sense. And that is in the hands of the state legislature, and they refuse to do it. So it isn't a matter of funding. In fact, what you're going to see is until they touch the ITA, and until we actually have people put into treatment facilities against their wishes while under the influence of the drugs that we don't want them to be taking because they're literally killing themselves, we will only see the problem expand, and we will only see a need for more funding.
And then like everyone questions on Facebook, where's all the money going?
Well, Yakima County, as I gave you a copy, so our Human Services Department on Yakima County's website does have a full list of all of the programs that we fund. It shows the dollar amounts. You can actually see a description of each of those programs. We conduct our meetings publicly when we are discerning and deciding which programs we're going to fund. We have presentations from those providers that give us an in-depth drive into what is it that they're wanting and proposing to do. And we run all of our contracts in 2-year periods because we want to be able to measure and be able to say, is this something we want to continue? And again, as I stated earlier in the interview, all of this is in its infancy for us. So we are still trying to determine what does success look like. And so we are in just our first year in many cases of funding for this because the funding has come in from the state and federal government, and it is going to really be, I think in the next few years, it'll be incumbent upon the future commissioners to decide, all right, we've spent this, we've now been able to see where did we see impacts, where did we not see impacts, are they the kinds that we were hoping and looking for, and do we want to continue funding these programs?
So that the money can be used in great ways.
Again, and that will be, it will be an ongoing community conversation of what exactly success looks like.
And you mentioned the laws kind of are lenient. That's another thing that you and Alicia can agree on. She mentioned the same thing. She feels like back in the 80s, back in the 90s, war on drugs, the laws were stricter. It was easier to overcome that than what we're doing now. Not easy at all, just easier because the laws were more strict than 2025.
What we have seen, especially in Washington State over the last several decades, and especially in the last 10 years, is a shift in how we treat adult offenders and juvenile offenders. And what we've done, which again is illogical, is that we have stated as a state legislature, who is our representatives, that you should be considered a juvenile up into and including the age of 25, because your brain has not yet formed enough for you to be able to contemplate long-term impacts, the severity of your negative decisions and those consequences. And in doing so, we have also rolled back what then are the consequences for people who commit these acts. But I might add, we at the same time of saying that if you commit a violent act even up into the age of 25, you're considered a juvenile because you don't have developmentally the ability to discern the long-term impacts, you simultaneously can at the age of 13 completely divest yourself of your parental control from your parents, and that you can become a ward of the state voluntarily and receive medical care and make significant decisions to permanently alter your physical body because for some reason you can consider the long-term impacts when it comes to that, but if you're committing an act of crime, you certainly cannot. So we have to rectify that. We're going to have to find a way as a state to rectify when can you make sound decisions and when can you not. And right now it is a box of chocolates. It depends on what the legislature supports and doesn't support as a means of an outcome.
And the lines are very blurred and gray.
And you know what youth want? They don't want blurry lines. They want to know what is right, what is wrong, what is truth, what is false, what is going to be safe for me, what is not. They actually want strong leadership. They want leadership from their parents. They want leadership from their elected officials to be able to say, these are the things that a civilized society requires to function. If you want to be a player in civilized society, these are the rules you're going to follow. And if you can't follow these rules, this is where you're going to be. You're not engaging in society. And there's always a path to redemption, but you have to follow by the rules, and if you can't, the rules are going to be different for you until you can prove yourself. And right now in Washington State, we don't have that.
And then they don't want mumbo jumbo either. They want it in the simplest of terms.
Yep. Yep.
Oh, okay, let's see what I have. Oh, solutions and transparency. Okay, are there any new programs or initiatives in the works? I know this is kind of still in its infancy phase.
Yeah, we just went out for our 2-year round, and so we're in the first year of a 2-round fund. And so what we will do next year is we will open up the opportunity for new programs that want to participate and be considered for funding. And so probably around June of next year, we'll start seeing any new programs come forward if there are any. But again, because we are the middleman for the grants, we don't create the programs. Right. The programs come to us. And I am very excited to see, especially again, with the advancement of more dialogue in the community, there will be people who will say, you know what, I feel like I have a solution to this problem. I'm going to create some type of a program and pursue funding, and that could happen very well.
And even like in addition to that, what do you think the community can kind of do beyond that, just as your average person in helping with the crisis?
I would say the best thing that our community members can do is continue to be very strong advocates for their personal health. Talk to your kids. Absolutely have frank discussions about with your kids about this. Seek out a program that Safe Yakima Valley offers, the curriculum. Ask your school to have Safe Yakima Valley come in and provide the curriculum, because the commissioners are paying for it. And it is a matter of the school districts and each school saying they want Safe Yakima Valley to come in. So those are the things I think locally they can do. Big picture, I think that when the state legislative session reconvenes in this next year in January 2026, I think it's very important for people to pay close attention to what the state legislature is doing when it has anything to do with parental rights, with the Involuntary Treatment Act, consequences for drug use and abuse. I think at the end of the day, most parents would agree that the consequences are a necessary enforcement tool, not only for a community and a culture, but for them as parents. It's very difficult, I think, right now to parent a child who's making poor decisions when you know that, or have a sense that, the criminal justice system on our state isn't even there to back you up. It used to be, when I was growing up, that my dad made very clear to me that if I was to commit a certain act that wound me up in jail, I would be staying there. And that they would be feeding me bread and water, and he made it out to be really miserable sounding, and certainly I formed an opinion that I would never want to go there, and I knew he meant it when he said I would stay there. And I think that now parents don't feel like they have that same backstop, because right now, again, our state it's a free-for-all. Children as young as 13 years old can go out and commit violent acts, and in that same evening be released into their parents' care. And mind you, we have to consider, does that parent even want that child at that point? And that is a product of our state legislature. And I would say and argue that many parents who found themselves in that position have said that they actually wished that that juvenile had been kept in the care of the state, because they were going to be safer, and they know that they would not be a threat to their family, they would not be a threat to their community, and really parents are begging for the government to actually help them have consequences that they can't enforce as parents.
And then on the other side of things, it makes your child a target, because it's basically a slap on the wrist.
It makes them a target specifically because the gangs and cartels have specifically come to Washington State because of our lax laws, and they are recruiting these very young, newly teenaged men especially, and females we're finding more often, to go and commit acts of violence in the name of the gang, because they know that they will have hardly any accountability. And again, that was a negative consequence that was a known factor. And if you listen to various professionals and law enforcement show up to the state legislature when our state legislature was contemplating this law, every single one of them said, don't do this, you're going to increase the efforts for gang recruitment in our youth. And again, our state legislature maligned. They will not listen to any dissenting voice to what they have already perceived as an outcome, which is to say that we simply don't want to have people judged by their very worst days. And unfortunately, if you're not able to judge people as a society by their very worst days when the act is against society, then you don't have a functioning society. Because we do need to have judgment and consequence, or we'll just have the same things happen over and over again. And I think anyone, even if you have compassion, of course, that we all do for people who find themselves in that situation, again, often, even if they were put in that position against their will, all you're doing is releasing them back out into that gang. Maybe putting them in jail was the best excuse for them to get out of that situation, personally as well. And those are the types of rationale that I wish our state legislature would think. So if you have a personal experience with this type of situation, your voice needs to be heard in our state legislature, because the legislators over there are incredibly misguided in what they're trying to force as an outcome, which is trying to keep families together without the recognition that sometimes even that juvenile is a threat to themselves and their family, and that might not be the best place for them.
And it's affecting everyone.
It is.
It's affecting law enforcement, it's affecting the family, it's affecting the child.
Well, businesses, how safe do you feel when you know that someone is going to commit a crime and we are not going to detain them? Why do we have laws if we're not going to enforce them, if there's no consequence?
Yep. That slap on the wrist. If someone asked, is Yakima doing enough, Yakima County doing enough, how would you answer?
I would say that because of our focus on prevention and transparency and trying to get accurate data, absolutely. You well brought up the fact that we are number one, and I stand by the fact that we're number one, not necessarily because we might actually have the more morose data, but because I know we're accurate. And I think that, again, the key to finding a successful outcome is first understanding the problem, and we are trying to understand the depths of the problem so we can find ways to actually solve it. I'm very proud of that. And then I'm proud that where others are spending fortunes on different aspects of this problem, that we have prioritized prevention. Our youth are absolutely our future, and I really credit this board for being very bold in making it clear that our priority is prevention, and even though it's the lowest denominator, it isn't because we want it to be. We are actively seeking ways to expand that, because again, preventing this cycle from continuing, I think, is the smartest and best way to approach this problem.
And you are all set for me.
Okay.
I think that was perfect.
Good.